Coming up on It's Personal, September 6th is the next installment of Steppin' Out in Pink. How can this breast cancer fundraiser continue to grow? Somehow it does, and we'll find out how they're doing it this year. Also, receiving funds to help with clinical trials at Gundersen Health System. And what are clinical trials in the first place? You'll learn more. And a bit later, using a BioBank to help defeat cancer. It's all next on It's Personal, brought to you by Gundersen Health System.
Between kids, the dog, working, and housework, it's hard to know where it all ends sometimes. But when it comes to your family's health, Gundersen Health System is where it begins. We understand you lead a busy life. That's why we provide most of the care your family will ever need, right nearby. From annual exams and broken bones to treating illnesses and chronic conditions, Gundersen is where health begins for your whole family. Need a primary care provider? Visit gundersenhealth.org/families.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, September 6th is the next installment of Steppin' Out in Pink. And how can the breast cancer fundraiser grow? Special events manager Debbie Kroner joins us now to talk a little bit about that, and already excitement about Steppin' Out in Pink 2014.
Chris, it is just going nuts right now. Our numbers are to date are ahead of last year, so we're expecting a large crowd again. Hopefully good weather. We always ask for 72 and lightly breezy, and it was a little warmer than last year. And I just spoke with Culver's yesterday. They have lemon ice at the end, and they are anticipating this is the biggest event that they handle, and so they're going to have buckets and buckets of lemon ice to cool everybody down at the end. But we've got a great lineup. We've got about 60 vendors already signed up, and they still come in till the week of and fill our spaces. So the tents will be full of a lot of different things. Some of it's pink merchandise, but others just jewelry, crafts. There's a lot of educational vendors too that you can take part in. And our lineup again for entertainment. We've got the stage, Pepsi stage, and we've got our main stage down on our main grounds. And then we have the UWL Screaming Eagles coming back in Powell Park and the Central Band. So another full lineup. If you haven't been to Steppin' Out in Pink before, I always tell people it's not a walk. It's an event. This is a family affair. We kick off with a survivor breakfast, and we had close to 300 survivors last year, and that keeps growing. So when we talk about the event growing, it's kind of a natural grow because there's more and more survivors, and they are bringing all of their family members for support. And once they come, they have a great time, and more and more come. So that's kind of the natural growth of it. But we kick off with a breakfast, just saying thank you to them, congratulations for being a survivor, and a nice breakfast, and then we take the picture, which has literally grown to almost making it 2 pictures in one because we fill 3 bleachers.
It's a panorama almost.
It is. There was one year where we actually did have 2 pictures because we couldn't quite figure out how to do this. And now we've got them all in one, but it just keeps growing so that it was just a small group, and now it's become this massive family.
You mentioned the survivor breakfast, which is an emotional thing for a lot of the survivors to be a part of, and you have an honorary chair again this year.
Yes, we have a mother-daughter team this year, so 2 honorary chairs. Trisha Demeen and Dee Powers, and they're from the New London area. And they just are a lot of fun. They've been with us for some of our events leading up to this. We were just at the Logger game, and Trisha and Mom did kind of a tag team thing, throwing one of the first pitches. But they have a great spirit, and most of these survivors do. They're grateful for being alive. They're grateful for their support system. So yeah, we will be doing other things with Trisha, and they will be speaking at that survivor breakfast, and then they'll also kick us off on stage to get the walk going. But we've been just blessed to have advocates that speak for breast cancer care at Gundersen throughout the year.
Well, Debbie, I know that we started this segment off by saying, how does this get bigger and each and every year? Part of it is simply that more people are surviving cancer, and that it doesn't matter whether you're with Gundersen Health System or wherever. People want to do their part and participate in a walk and do something to help fight this disease.
Yes, they do, and they also know that the money stays local. I think that is key. We have our own research labs that Gundersen Medical Foundation supports that are at UWL campus. So right here we are doing, in Dr. Shelley's labs, we're doing active research. We're also doing research on patient data, and Dr. Lander Casper has done some wonderful work with the data that we have here, along with many of the other physicians in our cancer center. So to know that we're not only doing research, we're giving money back to patients through our Paula's Purse Fund. That's for breast cancer patients. So if they need anything, we are there for them. And then we also still provide funding for mammograms for those who are uninsured or underinsured. So there's a lot of touch points for people to get involved. And like when I was saying that this isn't just a walk, once you kick off this walk, they are going to different markers. They're getting beads, they're getting stickers. The Lacrosse Radio Group has been a great sponsor. We've got one of their DJs at each of the spots so that they can hear the music, have fun with them. And then, you hit our Pepsi stage. Wonderful sponsor, can't forget them. They were one of our original sponsors, and they will have food there, another stage of entertainment, and then, like I said, back down to the main grounds. And if you can't walk the whole thing, we have shuttle drivers, and we're actually adding 2 shuttle buses this year. So if you're parked across the street from the hospital, you can hop on that bus and get down to the grounds easier, because our growth has made it so that the parking becomes a little bit of a problem, but not enough. We're also having bike racks. I mean, bike in here. This is all to keep everybody healthy too. So lots of ways to get down to the grounds without too much trouble.
Well, on September 6th, anybody who drives by Gundersen Health System in La Crosse is certainly going to see the impact and the power of Steppin' Out in Pink, that's for sure. How do people get involved in Steppin' Out in Pink? Because there's people out there listening that say, I've seen this, I've heard about it, I just haven't known what steps to take. How do I get involved?
It's pretty easy to register. You just go to steppinoutinpink.org. There's a click register button. If you have registered before, last year, it will autofill all of your information. So that makes it really easy. But if you're new, you just set up an account. You can even make a page and send it out to your friends and family and ask them to donate in your name. So that really helps us just get the money raised that we need to raise this year for the walk. And it's fun. People want to help out. And so just easy way to do it. You don't have to go door to door. But if you want to, we welcome that as well. We have paper registrations. Those are due by August 25th. They have to be postmarked by then. But our online is open till September 1st. So we're anticipating 7,000 walkers this year, and as the numbers are showing, we will reach that. So we're pretty excited.
Absolutely exciting stuff, and congratulations too on what looks to be another fantastic fundraiser for breast cancer research, and coming up here September 6th.
Thank you.
All right, Debbie Kroner again. She's the special events manager at Gundersen Health System. Really, through the foundation is where Debbie works. And if you'd like more information, you can always go to the website, as she mentioned, and get it there. Coming up next on It's Personal, Gundersen Health System received funds to help with clinical trials. But what are clinical trials, and why are they making a big difference? That's next on It's Personal, brought to you by Gundersen Health System.
As a cancer doctor, Leah Dietrich wasn't prepared for her own diagnosis.
Really, from the point that you hear those words, you have cancer, your life changes. I felt a lump, and I did what I tell my patients to do, but it was aggressive. The result was a double mastectomy, chemotherapy, and reconstructive surgery.
Always a proponent of early detection, she became even more of an advocate.
I've always told patients and informed them about the benefits of mammograms and self-breast exams. I think I'm even more passionate about getting that message out to my patients and to the community.
As a leader in breast cancer awareness and treatment, Gundersen provides expertise and a level of care that is unmatched in our area.
I've tried to use my experience to help other people, help them know that even though it seems tough, we're going to get through it.
Gundersen Health System, where caring meets excellence. For more of Leah's story and to schedule your own cancer screening, go to gundersenhealth.org/cancer.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, the National Cancer Institute has recently awarded a $12.5 million grant to Gundersen Medical Foundation, Marshfield Clinic Research Foundation, and St. Vincent Regional Cancer Center in Green Bay. And the idea is to really expand their clinical cancer research over the next 5 years. Dr. Kurt Oettel joins us now to talk a little bit more in detail as to what that means. And let's lob it right out there, Dr. Oettel. What does that mean?
So it's a program that the National Cancer Institute has really initiated to help bring clinical trials out into the community. We know that that's where the majority of patients are seen. They've had a number of programs like this in the past, but for funding reasons, financial reasons, a lot of this is being revamped. And we're basically, what the NCI, the National Cancer Institute, has done is said, we're going to take the previous existing programs, we're going to stop them, and we're going to kind of like start over from scratch. And everybody across the country reapplies, and people who have not been in this type of venue have applied. There were only 34 community sites across the country that were awarded this grant, and we were one of them.
That's pretty exciting.
That's very exciting to know that we are on the cutting edge and able to compete in this venue is huge.
You mentioned clinical trials. I don't think everybody understands exactly what a clinical trial is, and the name in and of itself sometimes I've heard is a bit of a confusing name. Can you explain what a clinical trial is?
Yes. So for us, especially in oncology, in cancer, to advance the technology, to advance the treatment, the only way we do that is through clinical trials, where we see patients and we offer them the standard of care, or we offer them the standard of care plus some drug, some treatment that we think might be better. That is really how we're able to move this field forward. And clinical trials are cumbersome, they're expensive, they're fraught with administration. It's a big deal. It's a big deal, but it's the only way that we're going to be able to advance our field and really be able to offer better treatments for patients to come.
Can you give us an example?
So, for example, I may see a new patient with lung cancer, and I may say to that patient, here's the standard treatment. Here's the standard chemotherapy that I would give you for your disease. If I have a clinical trial, I may say, here's the same standard treatment I have for your disease. However, I think that if I used a drug, a different drug on top of standard treatment, you may do better. And for me to do that, I have to do that in the setting of a clinical trial where we're really comparing apples to apples and oranges to oranges. And that kind of infrastructure that you need to have built in to your clinic, to your hospital, to your healthcare system is pretty big. It comes with an army of research people, statisticians, clinical research nurses, people who really can help monitor patients in this fashion. We have been doing clinical trials here for many, many years and have a lot of experience with this.
I want to ask you two questions. One, what do patients think? And two, how is this pushing cancer treatment forward?
Okay, so one, I do agree that patients initially think clinical trial, they think, oh my gosh, I'm a guinea pig. It's really not, because nobody gets less than the standard of care. So I would never offer somebody a treatment that might have like a sugar pill on it when there's proven treatment. That doesn't exist these days. So a clinical trial really puts the patient in the position of getting the best cutting technology available. So clinical trials are really a benefit for patients and being able to access that, because they may get drugs that they're never going to be able to get otherwise. Life-saving drugs, for example.
So on top of that then, patients then really have a lot of input from, it's a doctor-patient relationship that you have when it comes to treating their cancer.
Oh, absolutely. Absolutely. All trials are something that I would present to a patient, and then they would look this over. It's very much a shared decision making. But to back up to the initial point, though, that this is the only way that we're going to be able to move our field forward, so that I can turn around and tell a patient, hey, the best treatment for your cancer is this, and the only reason that I know it's this is because patients before you have come and participated on clinical trials, and there are drugs today that we routinely use that patients are living much longer that we never had access to 5 years ago. But it's only because we did clinical trials and we're participating in that we really see the benefit from it.
So that kind of answers the follow-up question there of how is it pushing the treatment of cancer forward?
Right, and it's exactly that. You know, it's interesting because our field, probably more than any other field in medicine, relies on clinical trials to really identify what is the best treatment. And we, just by the nature of our practice, are so involved in that process and so involved in the results of that process.
You said that there's a lot of involvement in a clinical trial.
Mm-hmm.
Is it getting better, or is it getting more cumbersome?
Well, it's getting better in the sense of we have more applicable drugs, we have better treatments. One of the downsides in participating in clinical trials these days is it's getting more expensive. It's getting more cumbersome to do the trials that we do. It requires more infrastructure, more auditing, more administrative costs. And at the same time, we're seeing the financial end of that becoming tighter. That's kind of why the NCI has revamped what they've done and rolled out this new program. And I think it speaks to Gundersen that we were selected.
How does this money then from NCI, again a portion of the $12.5 million, how does that make a difference at Gundersen?
That really allows us to continue and expand our clinical trials portfolio or our venue, so that we're able to offer more clinical trials to patients that they would not have otherwise been able to get in other areas.
It allows Gundersen then really to sort of stay on the cutting edge of technology and
Absolutely.
research.
Absolutely. We're, when you look, we're only one of 34 in the nation that in the community setting got this award.
Mm-hmm. While we're on the topic of research and cancer, I know the football has really been moved down the field quite a bit over the last 10, 15, 20 years when it comes to cancer. How exciting is it for you to be, seeing how treatment has changed and how, people are living longer and cancer is identified sooner?
Oh, it's so exciting, because there are cancers when even in my quote-unquote short career, I have seen the benefit expanded by years. Where I used to look at a patient and say, oh my gosh, there's no treatment that I can look at that it's going to make you live more than a couple months. And I can look at that same patient today and say, there are treatments here that I think will make you live years. I may not be curing your cancer, but I am making you live longer with good quality of life. And I couldn't do that. A decade ago.
We may be recording this, it may be for radio, but I think most people can see the smile on your face regardless.
Yeah.
Final question for you. I have to ask this. Cure for cancer someday?
Yes. Yep. It's good. And it's not going to be a cure. It's going to be multiple different drugs for different people at different times. And what we might be doing is putting cancer into remission for their lifetime, such that patients may die of something else. We, as an oncologist, we always consider it a victory if our patients are living so old that they're dying of their old age, if you will, not of cancer.
All right. Dr. Oettel, we appreciate your time.
Thank you, Chris.
All right. Dr. Kurt Oettel, Gundersen Health System Oncology. And when we come back, you're going to learn how researchers are using a BioBank to defeat cancer. That's next on It's Personal, brought to you by Gundersen Health System.
Are you confused by all the talk about the healthcare marketplace and insurance exchanges? There's just one thing you need to remember. Gundersen One. It's a new option from Gundersen Health Plan, which is locally owned and operated. If you need to purchase health insurance for yourself or your family, Gundersen One offers a choice of plans to fit your budget. To learn more or to enroll, visit gundersen1.org or call the Gundersen Health Plan Enrollment Center at 608-775-8092. That's 608-775-8092.
As a runner, Michael Bodie thought he was pretty healthy. However, his family history had something different to say.
I ran a half marathon, and 2 months later I had quadruple bypass. One artery was 90% blocked, one was 98% blocked, and one was 80% blocked, so they said, we have to do surgeries. That same day, the surgeon came in.
Like a true champion, Michael found a way to quickly get back in the game.
The minimally invasive route was attractive to me because it offered me at least a chance to possibly recover quicker and get back to my normal life faster than I would have been able to with the traditional surgery.
A leader in minimally invasive cardiac surgery, Gundersen provides expertise and an unmatched level of care.
The folks at Gundersen are rock stars. 2.5 weeks after my surgery, I started in cardiac rehab and actually ran on the treadmill. And a year later, I ran another half marathon.
Gundersen Health System, where caring meets excellence. For more of Michael's story and to learn your risk for heart disease, go to gundersenhealth.org/knowyourrisk.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, researchers are using a biobank to try to defeat cancer. BioBank is something that is at the La Crosse Consortium. And joining us now to talk a little bit more about this is Steve Cash. He's the supervisor of oncology research at Gundersen Health System and also the manager of the Gundersen Foundation BioBank. What is a biobank, Steve?
Well, a biobank is a tissue repository ours was started in late 2008. It's kind of has two arms to it. One is the formalin fixed paraffin embedded tissue that we are graciously given the excess from pathology, and that's all the tissue that has been kept for over 10 years. And it's at least 10 years or older. Gundersen keeps it for 20 years. Anything 20 years and older we get for our biobank, and we catalog it and put all the demographics in for that. The other aspect of the biobank is where we consent patients with possible malignancies, and we take a portion of their tumor and store it in liquid nitrogen for future research.
Okay, so storing tissue. Talk about what kind of tissue you're storing here, because you said you get this from Gundersen pathology, but what kind of tissue?
We actually have IRB approval to collect
IRB.
Internal Review Board.
Okay.
Yeah, it's Gundersen's ethical committee to make sure that anything that is done in the research aspect of Gundersen is done in an ethical and moral and legal way. Okay. But we have the IRB approved to collect from 21 different sites in the human body, virtually every site of the body that could be a possible malignancy or cancer. when a patient comes in and is diagnosed with cancer or a possible cancer. If the provider feels that there's a possibility it would be eligible to be in the biobank, it has to be a certain type and a certain size. They talk to the patient about the biobank. They're given a brochure, and if they consent to it, then we are notified, and then we're there in day of surgery.
So patients do have a say in this.
Oh gosh, yes.
All right. Why do you want to keep cancerous tissue around for many, many years?
It's vitally important in ongoing cancer research. We actually, our biobank, I'll give you a quick example. If there's a researcher that wants to do pancreatic cancer research, there's not a lot of tissue around. That researcher will contact 4 or 5 biobanks, one of them is ours, and he can get a lot of tissue, 20 or 30 samples from us, from 3 or 4 other biobanks, and then he has a statistically large enough amount of tissue to do a research project on to look for either diagnostic or prognostic cancer treatment.
Where are these researchers coming from to study this tissue or do tests on or to do research on?
We actually in our cancer research lab, we are currently doing research on this tissue. We have collaborations with researchers in 4 or 5 different states in the United States, in Japan, France, and Great Britain.
How long has the biobank been around? Because you mentioned that this tissue has to be over 10 years old. Is that correct?
The tissue that we get from pathology is 20 years or older.
Okay.
And that's all been fixed in formalin, so it's not going to deteriorate or decompose. But the tissue that we get from patients that are consented for surgery, that stuff is less than 5 years old. We just started this in 2008, but it's stored in liquid nitrogen at a minus 177 degrees Celsius, so it completely stops any type of decomposition of the RNA or DNA.
So there is a room at the Health Science Consortium that is full of cancerous tissue.
Yes, there is. We have a dedicated limited access room where all of biobank tissue is, the formalin fixed tissue is kept, and a liquid nitrogen storage facility with dual tanks that are monitored on a daily basis where all of the specimens are stored.
We're talking with Steve Cash, Supervisor of Oncology Research and the manager of the Gundersen Foundation Biobank. We're focusing on the biobank here today, but the question I have to ask is, you mentioned research is being done actually at the consortium right now through Gundersen Health System. Can you give us a little preview of what is being worked on to help defeat cancer?
Well, what our lab is presently working on, we are working on a protein that naturally occurs on white blood cells called CD43, but we've also discovered through our research that it occurs on some cancer cells, breast cancer and lung cancer, and we've actually done some research where we've been able to knock down that protein covering, on when it occurs on a white blood cell. It protects the cell, it helps it move around, it helps it grow. You use those same attributes and put that on a cancer cell, that's bad things. We've actually worked out a way we can knock that CD43 protein covering off of the cancer, whereby allowing the natural killer cells in the body to attack it and kill it. In some of our research, we've seen reductions of tumor size by up to 70%.
Got to be pretty exciting to be a part of that.
It's fantastic. It's great what we're doing, and we love it. I love it. I look at this as I'm really contributing to my community, taking an active role in not only diagnosing and treating, but hopefully preventing cancers in the future.
The door keeper, I guess you could say, to the biobank is really one of your jobs. Is it exciting also, though, to hear what other research is being done in these other locations that are using our the biobank at Gundersen Health System or the foundation?
I think it's fantastic. There are other biobanks. I know that there's one on the East Coast that has millions of tissue specimens in it, and nobody's allowed to use it but just a few people. They hoard it. Our biobank is free to anybody that wants to use it. You send us a request. If it's a valid research project, we'll give you tissue. I always maintain I want our tissue in our biobank coming in and going out at the same rate. And I think it's fantastic when I hear other researchers are using it. It doesn't do anybody any good sitting in the liquid nitrogen.
Yeah, and you can't solve cancer with it sitting there either, can you? Steve, thanks for your time here today.
Hey, no problem.
All right, if you want to learn more about the BioBank, you can certainly find that on the Gundersen Health System website. It's easy to find. Just go to gundersenhealth.org. And that wraps it up for this edition of It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Thanks for joining us.